You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, replacing missing teeth with dental implants. According to my first guest, he says nobody should be wearing a loose fitting denture. With us, we have one of Tennessee's go-to implant dentists, Dr. Dushyant Patel. Dr. Patel, welcome to the program.
Thank you so much. Long-time listener. Happy to finally be on the program.
Now, for people that don't know your implant center, like who's the typical dental implant patient?
So Randy, I would say the typical patients are in two categories.
Okay.
One category, they're the patients that typically they don't have the best teeth currently. They have bleeding gums, they have bad breath, they have cavities, they've been told they need a lot of work done. Maybe they've even been told they need a denture. Typically, they only come in when something's hurting.
Okay.
And for those people, if we can't save their teeth, we'll go ahead and remove their teeth, give them 4 implants and a whole new set of teeth, and give them their confidence back.
Okay.
And then the other category of patients typically are the ones that we see few and far between, unfortunately. And that's because they're already missing their teeth. They're already wearing a denture, or maybe they're not wearing anything at all.
Okay.
And they haven't been to a dentist in 5, 10, 15, maybe more years because they don't have any teeth. Nothing hurts anymore, therefore they don't need to come see me anymore.
Okay.
Every once in a while they might come in to get a new liner in their denture, and they don't really know the options that are available to them at the moment. They've been out of the system. They don't really know what dental implants are or how they work or if they're even a candidate.
Okay.
And those are the patients that we oftentimes can just get them in one visit, and the next visit they could be leaving with a whole new set of teeth permanently fixed in their mouth.
Okay.
Yeah.
Is that now, when we said at the top of the show, no more dentures, no more traditional dentures, do you think that's a future of dentistry? That 20 years, 50 years, where dentures as we know them won't exist, they'll all be attached to something like implants?
Oh, absolutely, Randy. I mean, right now, the improvements in the quality of life that even as little as 2 implants can make for someone is just so drastic. I mean, we can get someone that will actually give them teeth that aren't going to fall out when they're laughing.
So like 2 implants, what? And that makes a snap in, snap out?
Snap in and snap out, exactly.
Okay.
And, you know, some of the most embarrassing things that people have to deal with when they're wearing dentures is when they're laughing, their denture might fall out. When they're at a party and they have to pick which foods can I eat and which foods can't I eat. And for those patients, we can give them as little as 2 implants, give them a new set of teeth that'll click into place.
Okay.
And they don't need to worry about their dentures falling out anymore. And now they can open up the menu at the restaurant a little bit more. And that gives them so much more self-confidence and so much more control of their life back. And oftentimes, they even want to go a step further. And those are the ones that really want to take charge of their life and kind of hit the reset button, if you will, Randy.
Okay.
And they want to actually
reset
get back.
what? What do you mean?
So they want to go back to the point when they were young.
Okay.
You know, back, well, I shouldn't say young. Perhaps back to a point in their life when they were healthier, they had their teeth, they had the energy, they could go and do whatever they wanted. They didn't have to worry about restrictions of what they can and can't do. And they wanted to go back to that point in their life. And those dental
Can and
implants,
can't do meaning what they could eat.
what they can't, well, not even just eat, where they can go. A lot of times people will avoid going to their friend's house because they don't want to, you know, be in a spot where maybe they're making dinner and then you can't eat what they're offering. So then they'll,
This is what they tell you?
oh, absolutely.
Okay,
People do this
okay.
all the time. And people oftentimes will avoid social activities because they know that their smile will limit what they can do. If we're in an event, like let's take it for example, Randy. Let's say you're going to a birthday party.
Yeah.
Okay. Everyone there is happy, right? Do you want to be the one guy that's going like this?
Yeah. No.
You don't. So it's not just about eating. It's about what you can and can't do anymore. Randy, we could fill up literally every single seat in Nissan Stadium. We could fill up the entire Bridgestone Arena and every bar on Broadway. And I still don't think we'd be able to service every single person that could benefit from dental implants.
Okay, so there's that many denture wearers there.
I believe the most recent statistic is there's about 35 million people in America that are missing one or both of their entire row of teeth.
Okay.
35 million. I mean, that's almost 10% of our population.
Now, you've had a lot of training, you say, in implant dentistry.
I have, yeah. And, you know, we did a lot of surgery in school, but ever since then, I've been doing a lot of traveling just all around the country, trying to gain as much knowledge from my mentors in order to be able to provide the best quality care that we can. You know, dental implants is one of those things that it's so rapidly growing and developing and changing that if you're not constantly trying to learn and better yourself, you're already falling behind.
Okay, good. And how old can you be to get dental implants?
Randy, there's no age limit on this. You know, this is something that we used to think that some people would be too old to be able to do the surgery, but that's simply just not the case. You know, the oldest patient I personally have done dental implants on was 91 years old. And they know what they want to be able to do when they're 90, 91 years old is eat.
Okay.
They have free time, right? You know, they don't necessarily go to work anymore. They want to be able to eat whatever they want, and they want to be able to hang out with their friends and go to restaurants and order whatever they want. They want to be able to go to their great-grandchild's birthday parties.
That's
and
very
you know,
nice.
not have to worry about what they can and
So
can't
if
do.
90-year-olds are doing this, when a patient's 70 years old in your chair saying, "Doc, I'm too old," that's just not the case.
Absolutely.
They're not more likely to fall out if you're 90 years old?
No, Randy. It's really more about their individual, like medical conditions, and age is, fortunately, no longer a limiting factor.
Now, if you say that there's like 500,000 or more people in the state
At least
that have an upper and lower denture, then, and if dental implants are as good as you say they are, why aren't they all doing it? What's your take?
Well, Randy, let me give you a few reasons.
Okay.
First of all, the patients that are wearing a denture, they're not coming to the dentist anymore. You know, so therefore they don't need to come to the dentist. Therefore, I never get the opportunity to talk to them about their options.
Okay.
And second of all, let me tell you a little bit about those denture patients and how they got to that point. They've essentially had their entire lives story after story of failed dentistry. It could have started when they were a kid. They needed a filling. You know, their mom told them they weren't brushing well enough. They got a filling done. They grew up, that filling and it needed to be redone. They needed a crown. Then they needed a root canal. Then the tooth broke and now they had to get that tooth pulled. And then this was just a series of dominoes that just kept happening and losing one tooth after next tooth. And they're just sinking deeper and deeper and deeper into that money pit. And then finally a dentist came along and said, "Hey, let's just take all these teeth out and just give you a denture."
All right.
And that was and oftentimes that's a huge relief for them. And they can finally say, "Oh, thank God I don't need to keep wasting my money on these teeth," and just get that denture. And for those people, we can just give them as little as 4 implants and get them a whole new set of teeth that don't come out and completely change their life.
Okay, good. Now, on these people, let's say you're 70 plus.
Yeah.
I've read online that typical person in their late 70s, they're on like 3 or 4 medications. Can they still do it if you're on some medications?
Absolutely. As long as, you know, depending on the medication, we may need to get your physician's permission first, but by no means is the medications you're on a hard reason to not do implants. Maybe one reason to not do it is if you're going through head or neck radiation and chemotherapy. Those are probably the patients that we probably,
that's fair.
you know, there's limits. You know, I don't want to say that every person can do this, right? There is some people that are not going to be a candidate. That would probably be one big one that unfortunately we probably will not be able to do dental implants on. But by and large, if you're on any basic medications, let's say you're hypertension, cholesterol, maybe some controlled diabetes.
What about osteoporosis medication?
Osteoporosis is a common one that we can work with. Absolutely.
Okay. If it's under control.
Under control.
Okay.
Yep.
Okay.
If it's not under control, then unfortunately we will probably need to work with your physician to get you into a controlled range so that we can actually do the procedure.
Okay, but more than likely they could.
More than likely.
There's always something you could do.
I would say if you have 100 patients, 90 of them will think that they're not healthy enough, and maybe only 5 or 6 of them actually aren't healthy enough.
Okay.
Yeah.
Now, what about, there you say, so age doesn't matter. That's another one.
Yeah.
And do you think people, I think you told me, that you think people count their teeth and think they need an implant for every tooth?
We get that. I get this all the time.
Okay.
And patients will come in saying, "Well, doc, don't I need one implant for each tooth?" And they're counting it up. It's like, oh my gosh, 12 implants. How the heck am I ever going to afford that? I mean, Randy, I'm a dentist. I don't even think I can afford that.
Okay, good.
You know what I mean? No, it's as little as 4 implants. We connect them all together, and they don't come in and out. It's all, you know, one large row of teeth that function just like what you had prior.
What if you have bad gums, like gum disease? Are the gums too bad where they won't support implants?
Well, Randy, the patients that are getting implants typically have those situations. You know,
Okay.
You know, the patients coming in every 6 months that never had a cavity aren't the ones seeking this type of treatment.
Okay.
They're typically the ones that have bad gums, bad breath, infections, cavities. Those things are not going to stop them from getting dental implants. In fact, they're probably the main people that should be getting dental implants. And for those people, we can get their gums cleaned up, we can get their mouth back to healthy, get all of the infection out, get their breath where they need to be, get their smile back in order, and those are the ones that we can change their life for.
Now, what about pain? Is that what they're afraid of? It's got to be.
I think everyone, any reasonable person should at least have some level of concern about that. But the good news is you're numbed up. You don't feel anything.
Okay,
And
good.
oftentimes people have already been missing some teeth along the way. And what I always tell patients is if you can get through getting a tooth removed, getting an implant put in is 10 times easier. It really is. And if you still want something extra, we can offer sedation options.
You offer sedation, right?
We do, yeah.
What levels of sedation can somebody get?
So we do nitrous oxide for free. We don't charge a nickel for it.
That's like the
laughing gas.
Okay.
Yeah, and then we can do some oral conscious sedation, which we just give you a couple pills. You just kind of sleepwalk through the procedure. Also has a little amnesia effect, so you don't really remember a whole lot of what was going on. And for the select few that want a little bit more, we can also offer IV sedation.
What do you monitor while they're sedated?
We're monitoring their oxygen levels and make sure that they're still breathing correctly and their airflow is still going the way we want it to go. We're also going to be monitoring their heart rate, their blood pressure, any other major vital signs that we need to be keeping an eye on, just to make sure that they're staying within that healthy range during the procedure.
Is this true that some phobic patients, like you even give them a pill the night before so they could sleep because they're so stressed out about it?
Absolutely. Yeah, that's a very common thing. And not even just implant patients. I mean, we have patients that just need regular dentistry that will want me to give them a little bit of pill just to help take the edge off a little bit. There is no shame in that. You know, we get it. Coming to the dentist, not always an easy experience. Whatever we can do to help make them a little bit more comfortable in our office.
Now, in your center in Gallatin, and correct me if I'm wrong on this, my understanding is how dental implants are done most of the time is you go to one place where they do the surgery, maybe go to an imaging center, and then one place where they put the teeth on top, and in many cases they get them cleaned elsewhere. At your office, you do it all right there. You do both parts. Is that right? Is that why you're able to do it so quickly?
That's exactly right, Randy. I mean, we can often do it in as little as, you know, a patient can come in for their consultation, one appointment, they come in to get their molds the next appointment, and then I'm doing the procedure the very next appointment, and they're walking out right then and there with their new set of teeth. I mean, that is a very common flow that we see.
Wow, okay.
Yeah.
And how soon can they eat after the procedure if everything goes okay?
Next day. You know, after the numbing wears off, you know, we try to advise soft foods diet, you know, because you're still trying to get used to it. You haven't been able to eat like that. You know, it's like a baby learning to walk again. You know, you want to go slow with it. You know, you don't want to start running straight to the steakhouse or eating that, you know, chewy carrots or anything of that nature. But you can start eating right away.
So what do they like more? The way their teeth look or what they can eat?
We get both, honestly. We have patients that want us to just give them the functionality of their teeth back, right? They want to be able to bite into that apple or eat carrots or eat almonds.
Okay.
And they're not so concerned about cosmetics. You know, the big tough guys, you know what I'm talking about?
Right, okay.
Right, they just want to be able to eat meat again and they want to be able to do those things. And then we give them what they're looking for, certainly. We give them the functionality back, but then they're smiling again. You know, they're enjoying life. It's like they're a whole new person. They got this whole new lease on life. And you would just not believe they're almost like retraining their face because they're smiling so much more often. And salads, Randy, I mean, people really can't eat salads if they don't have their proper functioning teeth. You have to be able to, it's really small movements, lots of little things inside a salad. You know, they can't really tear it properly if they're missing every other tooth. You know, they can't taste it correctly even. And to be able to give them the ability to give them the taste and joy of food again is such a big deal.
That's a big deal. You're a dentist. So you probably think like the smile's the most important thing. How important is it?
Well, I don't think it's the most important thing because I'm a dentist. It's because oftentimes, what is the most important qualities we remember about someone? It's
their smile sometimes, okay.
Yeah. And pretty much in any survey on what people look for when they're picking a spouse, a smile is oftentimes the number one thing that people look for. You know, it gives off the different energy. And if it's not number one, it's probably top three, okay? Take, for example, you could have two twin sisters. They're both going in for a job interview, and one of them smiles and the other one doesn't. And they could have identical resumes, identical personalities, but one of them gives off a different energy. She's smiling, and she seems happy, and she seems approachable. The other one doesn't. Who are you probably going to hire?
Well, the one that looks happy and has charisma, I guess.
But they're the same person.
Just one. I guess you wouldn't hire the one with a prettier smile, but if one's not smiling, and one is, you probably hire the one that's
correct.
smiling.
It's the energy that it gives off.
Okay, good point. Good.
People that smile tend to look happier, and people that are happier tend to give off a different energy about themselves. You know, they seem like more approachable people, more likable people, more educated, wealthier. And it's not because their smile is doing. It's because of what the smile does for them. It changes their entire identity. You know, it's not necessarily because their teeth are perfectly aligned. It's because that it gives them that self-confidence back. And the opposite's also true, Randy. People that don't have a pleasant smile are oftentimes judged unfairly, but they are still judged because of the way they look. You know, if they
People with bad teeth.
Exactly.
Okay.
And this all came largely from watching movies and TV shows. You know, Hollywood is the #1 culprit for doing this. Whenever you're in a movie and you want to make someone look more poor or look less educated, what do they make them do? They give them brown teeth, or they make them miss a front tooth or something to that effect, right?
Yeah,
That's
okay.
because they're trying to make them look like they are less educated. They're trying to make them look like they aren't as well off. And all they had to do, it's not the clothes they're wearing necessarily, but it's because of the way their appearance is, their energy they're giving off. They seem like they have more of a self-confidence issue. And the other thing people think is when you have bad teeth is it's because you're not taking care of your teeth. And that's
Like you don't brush them.
like you don't brush them. You
Isn't
know,
that
it's like
true?
if you have brown teeth.
Isn't that true though?
No, it's not true. Oftentimes they're just, unfortunately, in a situation where they have a bad set of bacterial infections in their mouth,
Okay.
and they just can't get rid of it. You know, whether it be because it's their gums are bad or because they have an infection or something to that effect. They are in a situation where no matter what they do, they could brush twice a day, they could be flossing, they could be rinsing with whatever mouthwash, they'd be going to the dentist 4 times a year, and they still can't get their smile to look the way they want.
You say you don't judge people with bad teeth.
Absolutely not. They're the ones that need our help the most. They
Okay,
really
good.
are.
Now, because we get emails about this, and really dental insurance doesn't cover this. Medical, I mean, very small portion. Medicare, Medicaid doesn't cover this.
No.
What's the answer?
They finance it, Randy. You know, oftentimes people will come in and they know that what they want. They may not be able to afford it today, but they can afford it in little small increments throughout the course of several years. And that's what the overwhelming majority of people do for treatment like
Are
this.
financing this.
They just finance it
I
out.
mean, you have
break
to
it
have
up in
decent
smaller
credit, right?
payments.
I mean, you're not carrying it yourself. You're
Correct.
not carrying the loan.
Yeah.
Okay.
Yeah. So, and even if they have just maybe average credit, we still have options for those people as well.
Okay.
You know, and this type of treatment, it's a big number, but you know, when you break it down into smaller pieces, you do a couple $100 a month. It's no different than just like paying your electric bill after a while. And Randy, back to your original question on, well, because I'm a dentist, I think the smile is important. And it's not because of that, you know, it's not because I'm a dentist, it's because of what I've actually seen. You know, we can make the smallest changes and it can change someone's life. We can give them a few tubes of whitening and get their shade of their teeth up. We can round off a couple sharp corners in their teeth. We can give them a little clear aligner therapy and fix that lower crowding. It's like they come back a whole new person. It's like they have that self-confidence and charisma about them all over again. And we just had this guy just last week, in fact. You know, he had, unfortunately, he was in a bad situation prior to coming to our office. He had cavities all across the front teeth, and when he smiled, the exact words that he uses, people think that I used to use drugs.
Okay.
And he never did drugs. It's just because that he was raised in a household that didn't teach good dental hygiene.
Okay. Okay.
And people judged him unfairly. He came into our office. We just did fillings, Randy. He had limited means. He couldn't afford the fancy dentistry, and all we did was just cover up some of those areas, fix the cavities, and it's like he was a whole new person. I mean, the energy about him was so much better. He was going to job interviews again. He was dating again. I mean, honestly, it's one of my favorite things to do is just giving them their self-confidence back.
In all areas of dentistry, is this the happiest group of patients in your, do you believe that?
Absolutely, Randy. I mean, the patients that are just coming in for the routine dental care, the cleanings, the fillings, the crowns, of that sort, you know, often, I would, as much as we say it is important to do those things, we're never really changing their life by doing a filling on their back tooth, but we are changing these people's lives.
So do patients tell you, like, Doc, you've changed my life, like when it's all done?
They do, but really what really happens is they change their own life. You know, they had the courage to pick up that phone call and call my office.
Okay.
And they actually decided to
Did
build
something
up that
about
courage.
it.
Exactly. Randy, that's like half the battle, is just picking up that phone and getting that self-confidence just to come in and talk about it. And these are things that they don't want to talk about with their significant other. No, who wants to talk about how they're embarrassed about their smile, right? They only want to talk about that with the dentist, and that's like half the battle, is just getting there. All I'm doing is just using my tools to do what I do day in and day out, and then they go and change their lives.
Good.
They take control of what is important to them. I didn't do anything different than what I do every day, but they are a whole new person now.
Good, good, good. Now, you brought some photos as samples. Now, these are from your mentor because you said that you couldn't get the signed consents.
Yes.
Because I doubted you a little bit on the phone. I said, well, it's just teeth. And you said, I'm going to show you some photos.
Absolutely.
So let's take a look at them.
Absolutely. Now, all of these patients, one of their options was the denture, and they didn't want to do a denture. They wanted to do something that was much more permanent, that made them feel like a person again.
Okay.
A denture, it comes in and out. It doesn't really feel like it's a part of you. It just feels like it's a tool. So would you say she looks more attractive?
Yes.
Would you say that she even looks healthier?
Yes, for sure.
Would you say that she looks wealthier?
Okay. Are you getting me back for me just saying it's just teeth? Because it's obvious that it does make a difference in their in their appearance.
Exactly.
Let's take a look at some more. So these are from one of your mentors. They're not
Correct.
your patients, but they're samples. Is that correct?
These
Of
are
what
sample
this could be
photos. And here's another one. Look how much younger she looks in the after.
Yeah.
She, technically speaking, she's older in the after, right? Because
yeah. Okay.
Right. But she looks so much more youthful because she has so much of a different energy about her. Here, in the before, she didn't look very happy to be there. This was a smile that was likely forced because she doesn't like smiling. Now, I don't know this patient personally, but I can guarantee one of the most expensive things about this procedure is all of the new opportunities they'll have. They'll be able to go to more restaurants, they'll travel more, hang out more with people, and that is really what's going to change their life.
You say every one of them have regrets.
People that got to this point didn't get there in one day. They got there over years, maybe decades. And that means they've probably been thinking about doing something about it for years, maybe decades, until they actually got to that point. Almost everyone says, why didn't I do this sooner? Now, this is just a sample photo, but just look at how different they are in the after here. Look at how much younger they look. Look how much more energy they have about themselves. Look at how they're smiling more.
It changes his appearance.
It
He
changes
definitely is
his
more
entire-
handsome because of this.
Absolutely, absolutely. He just looks like a more attractive, more approachable person entirely.
He even looks more successful.
He even looks more
That's
successful.
one of the things I doubted when you say it makes him look more successful. But I think anybody looking at this, you could see that.
Absolutely.
So now we're out of time. We have about a minute and a half left. Of the two groups of people, one group, they're wearing a denture. The other group, they have really bad teeth. They feel like they're headed for dentures.
Yeah.
What are their options when it comes to dental implants in your practice for
So-
these people?
we can either do the snap-in, snap-out dentures or the ones that are permanent. The snap-in, snap-out, it's usually we do the 2 implants. Sometimes we can do 4 implants, and it gives them a little bit more chewing ability, a little bit more functionality. It does not improve the cosmetics, and it's still something that comes in and out. They do have to take it out at night.
Okay.
I essentially call this a better denture. It's still a denture at the end of the day.
But it's snapped
But
in.
it snaps in.
Okay,
Right? Most people that do this option have some sort of goal of eventually upgrading it to the other option, which is the permanent ones. These are the ones that are fixed in. They do not come in and out, and they feel and look like natural teeth.
How many implants for that?
As little as 4.
4 implants for a full arch of teeth?
Yeah, and we just do one flat price. So if I can get 5 or 6 implants, maybe 7, doesn't change anything.
Okay. Now what about the palate? Because on dentures, the palate's covered.
Absolutely.
Is this still covered a little bit?
No, we open up the roof of the mouth completely. The palate is totally exposed, and that's really big for tasting foods because that's where a lot of your taste buds and sensory, sensory nerves are. And when that's opened up, it's like that ice cream just tastes different when it's it's actually hitting your gums and not a piece of plastic.
Or like a cold beer?
Or cold beer, yeah. Warm
coffee,
soup,
I guess.
Yeah, it was coffee, absolutely. Love me some coffee.
So upper and lower teeth, you say it's permanent. So as long as they take care of them, come in for the cleanings, they're going to last possibly as long as they do.
Absolutely. The key is maintenance. Like anything else, you can buy a new car, and if you don't take it for its regular oil change and servicing, it's not going to have a good lifespan. The same idea, you still need to come in, you got to brush them like real teeth, you got to get them cleaned, but if you can maintain them, it should be a solution that lasts you decades.
Final message. We have about a minute left. The 2 groups you talked about, they have really bad teeth, and they feel like they're headed for a denture, or they're currently wearing a denture. They've heard what you have to say, but they're still skeptical. What do you say to them?
Come to our office. We do a free consultation. Come out, see what we're about, see what opportunities we have for you, shake our hand, and see if we're the right fit.
Okay, good. And they get to meet you on every one of these consults?
Absolutely.
Okay, good.
Yeah.
Free consult, that's nice. So I'm going to thank you again for coming on the show. And if they want to make an appointment, do they go to your website or they just call your practice?
Either or works.
Okay, good. Thanks again.
Yeah.
You've been watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. For now, I wish you good health.
Thanks for watching the Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.